So if you're all right with it, we could have the questions and we should talk, yeah, in the panel. So I'm asking the panelists to come to the stage. And if you know insight, you will be puzzled. Didn't they forget something? Like we have talked about psychotherapy, we have talked about psychiatry, we have heard the word depression many, many times, yeah? But insight is also a place where we bring idiosyncratic, subjective experiences together with the nomothetic and a science where we want to know what happens in a field. Yeah? So please take a seat. And we would like to integrate you into what we have forgotten. The name of the panel is Rethink Psychedelics with Us. So actually we wanted to have an audience interaction with you, writing your questions on a little piece of paper, but we just didn't follow through. So why do we have all these wonderful microphones? You can ask your questions now. So we have not only psychiatrists and other medical doctors here, we also have somebody who is, well, I now start introducing our guests, yeah? And I start with the artist. So Norbert Pals is an architect and artist with a focus on digital technologies. He's the president of the Berlin University of the Arts. He is also a deputy chairman and spokesperson for the higher education institutions in the arts. That is called in Germany the Landeskonferenz der Rektoren. This is a high institution. And we will definitely have to ask him how he will justify talking about psychedelics in institutions like that. Then you know him already. We have Andreas Meyer-Lindenberg, director and CEO of the Central Institute of Mental Health, Gerhard Gründer, professor of psychiatry, and we have Manveer Singh. So one of the things you could also ask, they didn't talk about indigenous uses. So that is a question we have been asked a lot of times. Where do the indigenous uses come in? Is it all about psychiatry now? Yeah. So I'm hoping that Manveer Singh, who is a postdoctoral research fellow at the Institute for Advanced Study in Toulouse, will add a few perspectives and observations when it comes to rethinking psychedelics and what we haven't talked about. Then we have Helen Fares. Yeah? Helen has a degree in business psychology, and she does educational work on international human rights abuses and mental health in documentaries and on Instagram. So, of course, we have Andrea. Andrea is one of the medical directors of the Ovid Clinic Berlin. You know her already. And we would like to give the first question not to the moderator, but to the audience. What's burning after these two talks and the opening? What are you coming in with now that we have opened the conference and before we have the drink? So maybe think a little bit about it before you have the microphones at your table, and you can ask anything to the okay, we have one microphone that we have to share. Not hundreds of microphones. I am very sorry. And this is the first question. Can we take the microphone? Please. Yeah. There. Can you hurry up a little bit so that we can have a few more? And we don't know what's happening now.
Thank you, good evening. This question just inspired by the latest talk from Professor Gründer, but if anybody else can contribute on this, is that I understood that new psychedelic treatments have to beat existing drugs in effectivity to reach the patient's hands ultimately. Is there any movement to revisit the effects, the side effects of already existing medications to compare the newer treatments on that scale and not only on the current effectivity scale?
For me, that should definitely be done. Actually, we had a regulatory workshop this afternoon with the regulators, for example, from BfArM and EMA. And in that workshop, I proposed to withdraw the approval for paroxetine. We have 5 different SSRIs on the market, or 6, and we should just withdraw the approval for the worst one, the one which is, causes the most withdrawal syndromes and which has most complaints by patients. So yeah, I believe we should re-evaluate. We talked a lot in this workshop, we talked a lot about risks with psychedelics, but talking about risks with psychedelics does not mean that we should not talk about risks and side effects and complications with the available drugs. That's my
Andreas Meyer-Lindenberg?
If I understood you correctly, the question was all about side effects in general for older drugs. One thing that I find interesting is that probably we haven't talked about the subjective effects of drugs in general. So for example, if you take esketamine, which you had in your first slide as a little bit like an psychedelic, esketamine has a lot of similar effects, but it is given in an exclusively medical paradigm. So people get this, and if they experience anything at all, they tend to view it as a side effect. They tend to get upset about it, and the acceptance of esketamine is often a lot lower than for psychedelics with the exact same side effect. I think because the paradigm is different, and you actually pay attention to what people are feeling, what the subjective experiences are. So I think it cuts both ways, right? So you need to be more attentive of the side effect, but also we should be more attentive of some interesting, positive, potentially even, illuminating effects that people have under conventional psychotropic drugs.
So thank you. So if you want to ask a question, raise your hand until you do. And that, I don't know if he will hate it, but I'm giving the first question to Manvir, yeah? Because in the last maybe 50 to 60 years, a lot of the discourse on psychedelics has not been very psychiatric. There has been an underground public discourse with a lot of claims what psychedelics, where psychedelics come from, how broadly they have been distributed in cultures. So you are doing research on that, and when you are asked, do we have to rethink psychedelics and psychedelic narratives? What is the first thing that comes to your mind?
Yeah, that's a great question. I saw the phrase psychedelic exceptionalism on the slide, and I think the feeling of exceptionalism that people have towards psychedelics then bleeds into the stories they want to tell. So I think there are a lot of stories about, Terence McKenna famously proposed a kind of stoned ape theory where human cognitive evolution started with psychedelics. There are theories that religion started with hallucinogens. But then there are also stories that I think are endorsed because they make psychedelics more palatable. There's a lot of fear towards psychedelics, there's a lot of apprehension, and I think it makes people feel better to think that psychedelics have been used in the way that we are often advocating with this kind of psychotherapeutic model ubiquitously around the world for millennia. That's what psychedelic shamanism is. And the fact is that there is actually very little systematic work examining where psychedelics have been used historically, how they have been used, and the good work that has been done or that is starting to be done shows that indigenous psychedelic use, psychedelic use before a couple hundred years ago, is limited to only a couple places, likely in the Rio Grande area of the Americas and southwards. If you want to include Iboga, then you have one other case, but otherwise it seems very constrained in its geographic range. And contextually, it is much different than I think we want it to look like. So Brabec de Mori, Bernd Brabec de Mori, is an ethnomusicologist and ayahuasca researcher, and he talks about this tendency to whitewash ayahuasca and psychedelics more generally. You go to the Amazon, in places arguably where psychedelics have recently spread with colonial movements, and psychedelics are not something that shamans administer to patients to help them deal with psychiatric illness. Very frequently, they're something that shamans consume, often in a context of sorcery, to divine sources of illness, to combat sources of illness. And so I think psychedelics, like any aspect of humanity, are much more complex in the societies in which they appear. But also more generally, the very exciting thing about looking at these indigenous contexts is there's an incredible diversity of use. There are mystical apprenticeships, there are all-night dances, there are initiatory contexts, there's some consumption by patients. I think there's an eagerness to promote stories that seem ideologically and monetarily convenient, but I think when we question them, there's a lot of very interesting stuff actually going on.
But do we have to rewrite everything in the history of, or the history writing of psychedelics of the last 60 years? Or is there something to learn for modern psychiatry from the use of psychedelics in indigenous cultures?
I think there is something to learn, but I think there's something to learn from indigenous cultures in the same way that I think there's something to learn from underground cultures. They're both contexts where people have experimented with these substances, where they've thought about how set and setting modulate them, where they've explored the role of specialists. So I think there's a lot of very interesting ethno-psychopharmacology, but I think underground cultures are actually, like countercultural underground spaces are similarly fruitful as places to explore.
It's almost like I'm trying, please also feel free to talk to each other, but I'm shifting it a little bit to Norbert Pals. So the relationship of psychedelics to the arts seems to be going in both ways. So psychedelics seem to be inspiring artists. And can we talk about that in 2023? That's the first question. And the other way is also present, I think, the way that we depict these complex inner states in art seems to also somehow influence the way that people experience it.
Let's see. Is it on? Yeah. Well, I think one of the aspects of today, 2023, is that I think that why I'm also here is something in which science and arts comes together. Our concepts of what we conceive as cognition and the mind are evolving, and I think it is interesting to look at psychedelics, how they relate to these new understandings. And I'm saying this because I think, personally, I'm much more interested that we develop a different conception of how the mind and perception work than in the pictorial outcome of art that is produced, for example, under psychedelic influence. Because I think through a better and a more holistic understanding of the world that can be induced, there's a potential of different actions that can take place. And I have to stress here also that I think when I talk about art, I see it as an instrument through which change and dialogue can take place. It is not necessarily a therapeutic activity, but it is something that relates one person to the other and is part of a discourse. So if we have different cognitive situations through which an artistic production is empowered, we will have also different types of artworks. And I think through a more holistic understanding, we will also have a different perspective on the world today and their challenges. And that's why I'm also here, because I think we have to push forward what we conceive as our instrument. And I'm very positive that through a deeper look into psychedelics, this expansion of what we conceive as the texture of our mind or our model can be propagated. At the same time, I'm very happy what you have also expressed. I could see that through this more holistic understanding, there's a potential of a broader base that relates different cultures with each other through time, but also geographically. And I'm very interested in, and I think it is an important point, how to construct a setting in which a structured process of this understanding can take place. Because after reading a little bit in the development of early research into this in the 1950s in Manitoba and how that was changed through the counterculture in America and how the perception of the drugs were changed, I think we have to really take care that we are guiding a dialogue very close to the science, and at the same time also, of course, not losing track of what countercultures have been doing. So I'm extremely excited to be here. And people were asking me, what are you doing there? And I said, for me, it's one of the most, if not the most interesting conference I've been the whole my life. Especially...
That's a statement. That's a statement.
Really, honestly, and I'm saying this because, of course, if you're dealing with the arts, you're always dealing with some kind of fuzzy perimeter that reaches out into the metaphysical or other fields of the unknown. But I'm also so glad to be here because I think Berlin and the scientific landscape and the cultural landscape is the ideal place to discuss this. Because we have to come to a different form of knowledge and a different form of acceptance in which the one pot is not the right one and the other one is the bad one or the speculative one. We need to really model a more complex understanding of what we conceive as knowledge. And that's why I'm so glad to be here.
Thank you, thank you. So, can we and do we want to learn something from indigenous contexts and from the arts? But I'm asking our medical professionals, do you want to learn something from the arts and such contexts?
At this point, and I do it without any grudge, I just would like to point out that we have a panel with 4 men and 2 women, and at this point, all the men have spoken. And I think smiling equality is better than the grudgy one. And I would like to hand the word to Mila, who's had the microphone for like 15 minutes now and would like to ask a question.
Where? Thanks, Andrea. My question is actually to all the mental health professionals there. So with all your experience that you have with the traditional psychiatric antidepressants and with psychedelics and with other therapies, do you see today mental health as an issue that affects individuals that are getting sick and need to be treated? Or do you see mental health as an issue of a society where our society needs treatment and needs different approaches to mental health and to treatment, but also definitions? And if yes, then how would you imagine such treatments for the society? Thank you.
It's a good question you could have a long conference about, and Gerd graciously gave me the first shot of this. I think, you know, one way to answer this evidence-based to look at different societies, which you can find around the world, and ask, is there a big difference in how many people are categorized as being mentally ill? When you do that, the answer is pretty much no, right? So there isn't a huge difference in the amount of mental illness that you will find in different societies. And there were earlier literature that suggested maybe in more rural, simpler, indigenous societies were less, but I think newer work has kind of discounted that. So in the first order, I would think the answer is probably no. This isn't a societal thing, at least not in my view, but the second answer is that I think Gerd has shown this very nicely. If you just categorize people as having a mental illness and put them in a bubble, and the other ones are in the bubble that is healthy, you're not doing justice to the situation at all. And most of us now think that mental health and mental illness is something that exists along several important dimensions, more on a continuum, right? And that you need to understand individual risk and resilience factors to try and help people get on these continua back into the, what was it, yellow, into the healthy bubble, so in the salutogenetic concept. So we are kind of moving away as a field from categorical diagnoses as labels of mental illness, but I still don't think it's mainly a societal problem, because no matter what society you look at, you find similar amounts and groups of people that would be labeled as such.
Helen, you're talking to people on Instagram about their mental health, which is also a new thing if we want to look at it in a historical context. They do it since when? 15 years? 10 years? How is this of relevance to people who talk to you about their mental health on Instagram?
Is your question about people that ask me? I would actually turn it around, to be honest, and rather talk about how people who talk about mental health on Instagram with a professional background impact people who have mental health issues on Instagram as the audience. And of course, I don't want to dismiss the fact that social media, especially apps like TikTok or Instagram, are highly addictive and can be dangerous. But I have to say that especially within the last couple of years, I have seen an immense impact on people who actually suffer from different kinds of mental illnesses, such as, or syndromes such as burnout, ADHD, depression, or actually also being on the autism spectrum, and who didn't know what was going on with them, and where I feel like people who talked about these things on Instagram, both people who are affected, but also medical professionals and mental health professionals, actually help these people to understand, I'm not a, fucking alien. And this is also something that I've experienced myself. And I think that this is something that is extremely powerful and super important.
So it's about normalizing?
Absolutely.
Destigmatizing?
Sorry?
Destigmatizing?
Yeah, also, I mean, of course, this is also something that's important, but I think especially for a person that is affected themselves, it is super important to see there are other people who feel like me, and I'm not alone in this. And I also would love to come back to the question that has just been asked, and I think that there are some aspects actually that could be helpful, that if they were implemented in the society, such as not living in these micro-families anymore, for example, where we have a better understanding of how to manage children and just work together as a village. And I do believe that normalizing these kinds of things could have a powerful impact on our society, especially if we talk about those on Instagram.
Yeah, thank you. Opening it up, yeah, thank you.
Thanks. Firstly, thank you for the beautiful opening. And I think I have 1,000 of questions in my head. I tried just to focus on one. It's interesting what I heard. It was more like how we can do better research. And I had an instinct of more asking the question, can we maybe rethink how we do research? Because I think as a psychiatrist, we do very linear causal things. And I think then we gather a lot of data and then we give interpretations to it. So maybe it's a time to rethink a little bit how we do research, because I think that's going to have an impact too on what the outcome can be. So do we see there opportunity to a little bit rethink research, what we put like these three, as I said, linear causal, and get out of that maybe, or you see it as a dead end of...
You're asking a certain person?
Yeah, I think everybody. I think it's more, it's an open question.
Wow, my turn. I think you are very right. The problem is that what are we trying to do with the current research? A lot of the research is being done today is actually aimed towards drug approval. We are not really looking at the therapeutic effects. We're not looking into how this can be done best, but it's showing safety, efficacy, and that it can be actually brought to the market without harming people. And this goes by certain rules. And it's very difficult to find, so who does studies? People who invest money, time, and effort, and there's also only a limited pool of that available at the moment. So I think a lot of the science at the moment is directed to bringing these substances into the field as medications. And there will be lots of things to think about, lots of studies that will be necessary to then find out how it can be done best. What is best practice when it comes to these substances in therapy? And I think then when we move away from doing mostly drug approval studies, there's a whole new playing field, but then again we will need funding and people who are willing to invest lifetime and energy into doing it.
Thank you. So I'm asking back, we're rethinking psychedelics. What are we not seeing? So we have a panel with an artist, with an anthropologist, with psychologists, psychiatrists. Is there something that we should do that we're overseeing? There come a question, yeah?
Hi, thank you. My question goes to, are we measuring the right things? Sergio asked that question. I'm kind of interested to hear your thoughts on it. And it probably goes in some of the same direction as the last question, but is symptoms the right thing to be measuring when we could measure cognitive abilities, other biomarkers, heart rate variability, sleep, social functioning, and physical health, for instance, digestion, nutrition, relationships, and well-being, and whether the patients like it or not. This probably goes to Andrea as well. Is the reason we're only using symptoms because it needs to be approved and it's an illness? Wouldn't it? I think we're losing a lot of the benefits of just measuring these typical symptoms. And I work as a psychologist with ketamine-assisted psychotherapy, and I often see patients that tell me that their life is better, but they feel exactly the same. But if I ask their spouse or the family or the friends, they will say that this is a brand new person. This is the person I married 10, 15 years ago. He's able to go to work, and they will still tell me that. I don't feel any different. So I think we're kind of making it harder by using this type of regime. But would like to hear your thoughts on it, especially Andrea.
Of course, the story of these therapies does begin with measuring symptoms and it doesn't end there. But we have to work with something that's palpable and we can turn into something we can really show to society, to people who are, assigning money to projects and so on and so on. And I think measuring symptoms is something that could be like this, like a common denominator for what we're doing, and then we will have to go beyond. And I fully agree with you. I'm working both with ketamine, IV ketamine, and with psilocybin on the episode trial, and sometimes we see it, especially long term, people come back after half a year or a year, and we talk about their benefits from the therapy, and they say, okay, like when we would do the depression testing, okay, this doesn't actually look as good as we would have hoped. People are going back, relapsing partially, but they say, okay, I learned to cope differently with what's happening to me. I know I've been out of it before, I can get out of it again. And there are learnings that you won't see in a Hamilton score or a BDI. But this is something that is perhaps more for the clinical application at this point in time than for research.
The conference has a certain bridge or arch. We're starting with the medical discussion, bringing in these other fields. And we're ending with Bewusstseinskultur on Sunday, where we're asking the question, can altered states of consciousness add something to our relation? Can it help us solve the planetary crisis? This is a big question that Thomas Metzinger is asking. Maybe it's good to keep asking about how we measure things, yeah? But I'm also just inviting you to broaden your view and ask maybe also the one or other naive question or add another aspect. We've also had the arts formulating, Norbert Paltz, not the arts, a question that was actually directed, if I understood it right, to conceptual work, renewing the way we think about ourselves and the world at all. Yeah.
I'll attempt to ask a question that strings the interests together. What do you think, or is there a role for rituals in psychedelic therapy? And if so, how would a ritual or contemporary ritual look like for a Western society or treatment in Western society in forms of art or what we can learn from the indigenous, or also if you can do that even in a hospital room? That would interest me.
That's a cool one. Who wants to answer? Yeah.
I will give a quick answer. I think it is a very, very interesting question, and I think this is also opening up a new space. So if we are embracing a different conception of the mind, I think it is very important to also frame it with a certain procedure. And in the arts, I remember there was a project by the artist Marina Abramovic, and it was not about psychedelics, but it was about starving for 1 week and then doing an artwork. And this was ritualized in a way that every day there was a certain protocol. And this bound the group together, and then on the last day, after 1 week, they were doing one artwork. And I think that when we are talking about art, we of course talk about the artwork itself, but also the creative process. And I think this is an interesting field to explore and opening up new ways of practice. So just as a short insight.
Just to add something, many people have said this before, but the therapeutic or medical encounter is already filled with ritual. A person wearing a white coat, putting their degrees on the wall, handing you a little bottle that has a particular color, you sit down, you put on a gown, whatever. I mean, it is filled with symbolic actions, with signaling meaning. So the question is really not whether we will import ritual into this therapeutic encounter, it's what kind of ritual. And I think there's also already such a recognition. I mean, it's from the earliest days of the psychedelic enthusiasm of set and setting and shaping the experience. So the question of what we will put in, you know, I think we have the world to choose from, but I think what everyone has understood from, you know, practitioners in what we call indigenous societies to, you know, Santo Daime shamans in Israel is that things, actions, music, every part of your environment is filled with cultural associations, and it's about leveraging those and knowing how to leverage those in ways that really shape your participants' experience. Maybe a bit non-committal, but...
Yes.
Hi, I just wanted to ask, I've noticed there's been a hyperfixation on the drugs in the psychedelic talk here. And my question is, are there room for non-pharmacological methods of inducing an altered state, specifically those that rely on mechanical sensory manipulation, such as flicker light, flotation rest, and multimodal Ganzfeld? Are there room for these in this psychedelic umbrella, do you believe?
I'm so glad you're asking that question. Because actually this is exactly what we, for example, are doing at the Ovid Clinic. We do have the non-pharmacological applications. We have the Lucia lamp as a flicker light. We have VR applications. We do use breathwork, partially, not very often at the moment, because it takes a lot of skill on the side of the therapist as well. And of course, the important thing is not the substance. If you are willing to see that it's not reductionistically just neuroplasticity or just opening a learning window in your brain, if we talk about the experience being beneficial, and I think many people can agree that it's at least a part, there is definitely space for seeing that. And there have been quite a few projects also showing that. I know that, for example, Johns Hopkins is also doing research on breathwork for patients, and I think that there's a lot to learn. And we also should not forget that altered states have been used like always and very often not induced by any substance. People can go places and there's things to learn and to see there.
Many hands go up, so yeah. Maybe let's go very, very on the top. I have no way to see who was first.
Thank you. I wanted to ask, there has been little or almost no discussion on the multiplicity of the psyche and during psychedelic experiences or expanded states, working with systems, therapies like internal family systems or somatic internal family systems, getting people really in touch with different parts of their psyche and non-pathologizing certain conditions that might be manifesting as a result of certain interactions or environmental factors. And I'm wondering, I know that the Mythhoffers have done research with internal family systems and MDMA, but if there's any research going on with psilocybin and internal family systems, or if we're at all incorporating just somatic movement, like whole being health instead of just mental health, like integrating the nervous system, somatic practices, if that's being at all investigated with mind.
There's somebody who feels he could answer. Try it. Try it.
Since nobody is grabbing that question, I think we should be aware that there's very few trials and they're very directed. There is the option for far more, but also these techniques have to be mastered by the people doing the research, and it's just not been, to bluntly say it, a priority yet. I think there's a lot to learn, a lot to see, and as I'm saying, I think after the approval process, we have to look into what works and what doesn't, and we're just not there yet. So this is future's tunes that we're trying to listen to already.
We have an interesting talk at the conference, which is about the inner healer. So I'm talking about translating some of the languages that have been developed in underground therapies or in non-psychiatric discourses. And that is an interesting thing. Maybe the metaphors that people are using and developing there can be of great help in really doing therapy. But there's also an epistemological question there, because a lot of people are claiming that the inner healer is some kind of existence, a being. Yeah? So you see that different tribes are coming together and are debating epistemologies, and I wonder if we couldn't work more on translating these things into the languages of psychotherapy, of psychology, and back, instead of claiming this is the right phenomenon, this is the right language. Sorry, I was supposed to be the moderator. We have space for two more, and then we should get to the drinks. Yes. Now, yes, please, person up there.
I have the microphone already, thank you. So you spoke on Metzinger, and he wrote also in his book on Culture of Consciousness on attention extraction economy. And I would say that here capital or capitalism has designed digital environments that can be harmful. And do you think there are risks maybe of a psychedelic capitalism?
We could take that to Sunday, but I see Norbert Pals is already heading towards it. Please do so. Yeah.
I think it's. I really like the question. And in preparation of today, I was really thinking whether, let's say, a more expanded conception of our mind model could also be something that creates a different relationship, for example, to contemporary technologies like as AI. And I think we have to really look at it through many different lenses. And one would be, is there the risk of, let's say, an instrumentalization? Or is there also a potential for, let's say, creating a different autonomy? And I think these are all incredibly interesting fields to explore, but I think it is very important that the criticality in what we are seeing today is really maintained. But also in a constructive way, how can we take that and move it in a direction which gives us more autonomy and then become a different source in the dialogue?
Thank you, because we have really a lot of men speaking. Is there a last question from a woman? Yes?
I am a woman and I have a question. We've been focusing in psychedelic research on alleviation of symptoms for obvious reasons, but I was wondering especially if you take a look at qualitative data, reports from people who have gone through a psychedelic experience, can this data help us redefine and understand better the genesis, the roots and causes of mental illness beyond the categorization of mental illness into different sets of symptoms? So can it help us explain human suffering at a more general level? So it's a philosophical question, I would say.
No, I give it to the panel.
I think there is no good answer yet. As Max pointed out, we will have the largest collection of qualitative interviews from our study. And maybe we get some answers to your question, but there will be no definite answer. As you said, it's a philosophical question, and this is all about definition of the psyche or mental health. What is mental health? Where's the border between health and disease? And what I believe what we already learned is that many of our clients, they, even when numerically still depressed, they have a different outlook on their life, on their future, on their past. So, yeah, I think it will definitely help, but we will have no simple answer. Okay.
Thank you, Gerrit, and thank you, audience. We have started to rethink psychedelics on the conference, and I wonder where we will be on Sunday. Hopefully inspired by a lot of the talks in 4 panels. The conference is restarting tomorrow, and I promise that not all panels will be as broad as this one, but that was the concept, bringing things together and trying to find new ways and inspirations. We're inviting you for a drink. Don't leave immediately the Langenbeck-Virchow-Haus. Maybe you want to get to know a person you would never talk to a night. So enjoy. Thank you. Thank you.